Good afternoon, everybody. Welcome to another episode of Pod for Health Innovation. I'm Jen Covich Bordenick, CEO of Executives for Health Innovation. Today, we're talking about the rise, utilization, and impact of telehealth, telemedicine, digital health, whatever you want to call it, on healthcare delivery. And I'm really thrilled to be joined today by Dr. Roy Schoenberg, who is the president, CEO, and co-founder of Amwell, one of the largest ecosystems in the world. For those of you who don't know, Amwell connects payers, providers, millions of patients in all 50 states. They're working with 55 health plans, representing over 80 million covered lives, 240 of the nation's largest health systems. That includes 2,000 hospitals and over 100,000 providers. So incredible scope there. Amwell just received the Frost & Sullivan Best Practices Customer Value Leadership Award, which says something about their customer service. Dr. Schoenberg was named one of modern healthcare's most influential people in healthcare. And he's an inventor at heart. Dr. Schoenberg has over 50 US patents in healthcare technology, which I didn't know. That's news to me, Roy, so great. And welcome to the podcast.
Thank you, Jen. I'm blushing and now I have performance anxiety. Thank you for the introduction here.
Well, please don't. We've had several conversations with Roy over the years and is just a wealth of knowledge and always leaves us with something new. So we've heard a lot of research. We've talked a lot about telehealth. We know that there was rapid adoption during COVID, after COVID. One thing I found really interesting that you said it's really not about the consumer adoption. It's not the adoption of telehealth by consumers that's the story. You said it's the adoption of telehealth by providers that's the story. Tell us what you mean by that.
Yeah, well, I think, the story of telehealth in most people's minds has always been about this fabulous experience of a patient who can use their phone, download an app and get in front of a clinician for whatever ailment they have at this point in time. And obviously, when we were all locked at home, during COVID, this was, a saver, a saving technology for everybody. And I think for most part, it continues to be perceived as something that really helps with access and convenience. And don't get me wrong, I'm not mocking that. Payers, for the most part, have been really adamant about giving this as an opportunity for patients to not have to go to an ER or whatever it is and get care. And it works, and it still works great.
Right.
But as you can imagine, it was very, it kind of trailed the issue of COVID. When people were locked in, the volumes were very high. And then when COVID went away, things opened up. People started using alternate ways to get healthcare, and it kind of went down. But what remained after COVID, so if you look at the consumer, it kind of went up and down. What changed during COVID is that clinicians who were, by the way, also locked out of seeing patients, started utilizing this technology and found that it was not only, a breath of fresh air for patients, but it was actually a very useful tool for them. They could make a decision about following up on certain patients regularly through technology for a couple of minutes rather than having it in the office in a variety of other ways. And the interesting thing is that clinicians, when they started using it more and have never stopped. So when we look at the trends of volume that are on our systems, you mentioned kind of the ecosystem of Amwell, we really see the volume that's driven by patients have come, up and, to some degree have stabilized. The volume and adoption that's coming out of provider is skyrocketing and it continue to grow. And maybe just to give you a statistic or, kind of an indication of how crazy that is, so we serve quite a few of the national payers. These are huge behemoth organizations with tens of millions of patients. For the first time, after COVID, we have seen one health system, a couple of hospitals, generating more volume of telehealth per month than a national payer.
Wow.
One health system. There's a lot of them out there. So you begin to see how the pendulum is swinging towards prescribed telehealth, where clinicians are telling their patients, I'm going to check up on you, we're going to see each other next week, but you don't have to come to the office. And that's also, probably one of the most profound changes to what kind of telehealth is being delivered, because the consumer telehealth was really mostly about urgent care and behavioral health,
Right.
relatively simple things. Now we see clinicians using telehealth to follow up on patients with cancer and heart failure and, frail diabetics and variety of the rest of healthcare as we think about it. So the implication is that telehealth is utilized in a completely different way than ever before. And the story is the clinicians, not the patients.
Yeah. One thing that always drives me crazy is people saying that telehealth is going to replace the in-office appointment. And I guess what we've seen is a lot of kind of follow-up appointments, and all of those kind of check-in appointments are very easy to conduct by video or telehealth. Are you seeing that kind of spill over into other specialties? It sounds like you mentioned cancer, so oncology. Are we seeing the uptick in other specialties?
100%. I mean, the moment, for the majority, I would say that the use of telehealth by health systems is for follow-up care for chronic patients.
Okay.
It's actually not for urgent care. It's not for the simple things, not for the flu. There is the occasional that, but most of the telehealth that's been used by tertiary medical centers is to balance how they manage their long-standing patient relationships to be a combination of physical and digital. And it is usually those patients that need to be seen fairly regularly. And you can imagine that ties to certain, more severe medical conditions. And that's why it's cardiology and surprisingly surgery. You don't think of surgery through telehealth, but a lot of the contact with the patient before and after surgery is actually taking place through telehealth. So it's a completely different set of ICD codes and CPT codes for the folks in healthcare here that we see over telehealth that we have never seen before prior to COVID.
That's incredible. It's incredible. One of the things we heard a lot about was how this was going to create more equity in healthcare, because it was going to increase access in rural areas and just to specialists, et cetera. Do we actually have evidence? I mean, you guys have a ton of data on what's happening right now, that telehealth is actually improving access?
Yeah, I think, to be honest, I think that the answer is no.
Okay.
We don't have data, mostly because I don't think that we're really tracking that data the right way. I think you have to pose the question to understand what data you need to follow. And I think a lot of people are hesitating about how exactly do you ask the question of measuring equity. It's loaded. So I would say that even though the gut tells us that there is definitely increasing access, there's no question that the internet goes to places that usually sometimes don't have a lot of staffed physicians in. I think that it's still going to be some time before someone comes up with, with a numeric answers to that question. But I would say one other thing, and you mentioned it earlier on, I think that for as long as people are thinking of telehealth as a way to do what you did in the office over your phone, so it's one-to-one, we're just doing it through a different modality, I think it's going to be really hard to prove that we're changing equity. The early signs that we're seeing now, and again, this is very new, is where people are actually rethinking the distribution of healthcare altogether from the ground up. And the best example that I can come up with, there is a fast growing and very, very powerful movement to introduce the notion of virtual primary care into the mix. That's coming from the large payers. It's a very complex offering because it requires technology and clinicians and patients to establish a relationship in a different way. But when you think about it, what it means is that we're rethinking completely how primary care is going to be experienced by Americans. And if we're saying primary care is going to start utilizing technology, and then it will refer to physical care as necessary, but your PCP and your relationship would actually be carried over technology, that to me is the first indication that we are completely restructuring the system. This isn't just about, the convenience of doing it over your phone. It's complete rethinking about how different level of care and different level of service are going to be democratized because of this technology. So I don't think the numbers are in there yet, but to me, the virtual primary care revolution is the first qualitative change to the structure of the American healthcare system in a way that will dramatically change the availability of healthcare to everybody.
And are you piloting this virtual primary care system with some payers, or how's that
We
happening?
are, it's known, right? I mean, we rolled out virtual primary care with CVS and Aetna, just a couple of months ago in a very, very big way. We're doing equivalents with other payers. Because this is new, different payers have different views on what needs to be included in it. But I can tell you that, maybe very differently than even a year ago, I don't think that there is any single payer that we're working with that doesn't have it either as something they're rolling out or something that they're contemplating rolling out in the very immediate future. This is truly an earthquake in terms of how we're structuring care.
Are the metrics for quality on that going to be different in terms of, how are you measuring your success with that virtual primary care? Is it patient satisfaction still? Is it?
Yeah, I think, because we're not considering what we do to be a different kind of healthcare,
Right.
but rather thinking about it more as a different distribution and productization of traditional products. We're not changing who the clinicians are. We're not changing the standard of practice or whatever it is. That we do believe that the effort of defining quality measures should remain with the same organizations that we trust today on the physical side of care to do so, whether it's NCQA or whether it's others. And I think they're doing a good job in entering and understanding how to measure the same metrics on digital equivalents. But we are very much so measuring the sentiments of the people that experience healthcare on our platforms. And I know it doesn't sound, maybe it's a little bit closer to NPS or whatever, people are using. We actually found that capturing people's general sentiment by saying, this was great, this was or this was bad, the thumbs up, thumbs down, very, very, gut response is a very, very strong and effective indicator to whether all of the different pieces of the puzzle worked well for that clinician and for that patient. It goes beyond technology, its availability and how they connected and the experience and the data that was involved and so on. And we are comparing those numbers with the equivalent sentiments that are captured in physical settings. And our commitment and our numbers are indicated that consistently across all of the different companies and organizations that we serve, the sentiments are higher, are better for digital encounters than they are for physical encounters. And we can open a bottle of wine and ask why and talk about why, but that's for another time. I think that the fact that people consider that to be a very approachable and a very, very engageable, useful way for them to get healthcare is the testament to the fact that this needs to become part of the way we think of healthcare.
I think that's a really important point. And one of the things that I've found as someone who has a chronic condition, talking to my PCP or my nephrologist, I actually think I have a better relationship with them now because I've got their undivided attention and they have to kind of stare at my face. I have to look at their face for a full 15 minutes, whatever it might be. But I mean, are you finding that at all anecdotally that you think it might actually result in kind of a different type of relationship between patients and providers?
Yeah, I think, there's very famously, it's true for all of us, when we come into a physician office and we sit on that bed with a paper on it and everything else, and the clinician asks us, do you have any questions? All of us say, nope, no questions, we're fine. And this has been documented multiple times. And I think it is partially because of the fact that the balance of power, in a positive way, but the balance of power in an exam room is challenging for a lot of people. The clinician seems to be very busy. You are sitting in an awkward position. They're dressed up really nicely. Sometimes you have your pants off, frankly. I mean, this is not a comfortable situation.
Right.
Whereas when you're conversing with a clinician through technology and you are in your own setting, there is more of an eye contact, there is more of an equal grounds, even though they're the professional and you're the one receiving the services. It helps allow you to feel like more you're in a way equal. And I think that fosters a completely different conversation. So yes, what you're describing has actually been repeatedly communicated by a lot of people. And I think that in some ways the technology really helps people have a conversation versus cases where settings like an exam room are not really conducive.
And I think it's such an important point that there's a lot of comparisons between telehealth and in-office, how do those two compare? But I actually think there's a benefit to this that we're not measuring. So yeah, I think that there are some things we have to figure out how to kind of explain this benefit of the patient relationship.
Yeah, I just want to add one more thing.
Yeah.
And it's actually also tying to the notion of equity and so on. We always think about it from the patient perspective. We hardly ever think about it from the clinician perspective. There is, and there is a big issue about clinician burnout, which we know is really one of the biggest issues in the healthcare system. And one of the advantages is that a lot of those encounters, if you can actually collect them right, allow the clinician to be home as well.
Right.
And the quality of life and the ability of a clinician to actually have a more balanced lifestyle allows clinicians not only to have a more relaxed conversation with you, but it helps a lot of clinicians who were thinking about getting out of the business and not being available to actually say, well, but I can do that. If I have to work in the office, in the clinic for 2 days or 3 days a week, and then I do 2 days through telehealth, that's a balance of life that I'm actually willing to sustain. That in turn allows more clinicians to remain in the pool, makes them more available, and will, in that sense, potentially allow better equity because more clinician services are available to the same pool of patients that need to see them. So there are macroeconomics here, so to speak, that go way beyond just, the one-to-one telehealth experience between patient and provider.
That's a great point. And I have heard that from a number of physicians. That they do like having those 2 days at home where they just talk to patients. I think that's such a great point.
Yeah.
And I would be remiss if I did not ask you about the cost issue here. So is it a cheaper way to manage a patient for primary care? I mean, do we have any data on that?
The general sentiment is that telehealth is less expensive. One, if you compare it one-to-one, with inpatient clinics or outpatient clinics or whatever it is, for obvious reasons. Just like the cost of selling a good online is less because you don't have to maintain a store and a staff and everything else. And the same things happen here. I think the part that is going to be more interesting is when you think about the dynamics of interacting with the patient over technology. It is, understandable that it's easier for patients to be compliant with the sequence of follow-ups when they do it on their phone from home than taking the bus and going to the hospital every time. The question is, how much value are we going to capture if we're able to be better companions with patients through the course of their disease because it's easier for them to play their part? And if we can interact with a cancer patient once a week in their home rather than wait for once a month when they actually come to the hospital, how much more can we discern? How much more can we catch? How much more can we intervene on at an earlier time in a better way because that new dynamic is beginning to emerge? I think that the jury is out, even though it is inconceivable that we're not going to find the cost saving there.
Yeah. Oh, good. Great point. What would you say is kind of the number one thing right now standing in the way of broader adoption? Is it the
Just
policy
one?
issue? Yes, one. Give me two. All right, two. Give me two.
No, I'll say this. I think that prior to COVID, it was still a lot of misunderstanding, a lot of misalignment in people's knowing on what they can and can't do through telehealth. And I think for the most part that's come and gone. To me, I think it's not about reimbursement policy anymore. It's not about, training and education anymore. I think it's the fundamental gap in understanding of what is the role of state licensure in a world where healthcare can travel over technology. Both as a country, we need to be able to pool together our resources for the well benefit and care of the American people. It makes no more sense to have people that live in one part of the country where the knowledge on how to treat them and help them is, exists and is available right now. And because of an arbitrary draconian rule that used to be guild oriented around physical geographies is now standing in the way of making that knowledge available to the patient.
Where do you think that change happens then? Is that a federal issue? Is it a contract, compact, these compacts that can be signed between states? Where do you see that getting resolved?
I'm going to be very cynical and very maybe controversial here in saying that I think we need to understand why there's a lot of issues between the medical boards about allowing, cross state line licensure, and sometimes real life get in the way. A big part of the revenue that state medical boards live on, and they have an important role of maintaining quality and everything else, but a big part of what sustains them is the medical licensure. If we are going to solve that financial hole for them and say, we're going to find other ways to fund your operation around quality and reviews and all that kind of stuff, and it's not going to rely on medical licensure, I actually think that the resistance towards reciprocity or pacts or whatever method you're going to use is actually going to diminish fairly significantly.
Yeah. So you've got a plan for that.
Yes, I'm sure that there are going to be some people that are going to say that that's not the case, but good conversation to have anyway.
Yeah. Well, let's talk about the market a little bit. So we've had, hundreds of telehealth companies pop up, a lot of vendors out there right now. I know there's a lot of uncertainty right now with some of the technology and the banking and funding right now. So what do you think, what do you think the future looks like? Do you see a lot of consolidation of these smaller companies? Do you see them just not getting the funding in the future? Where do you think we're at with that?
Yeah, I think, if you're onto something good and you're able to communicate it, usually the funding will show up, maybe at a higher valuation or lower valuation, but, good ideas actually, have a future. My preference personally would be to see interoperability rather than consolidation, because that allows a lot more smaller companies with great ideas to plug themselves into the ecosystem and, prove that they deliver value, and hopefully that allows them to grow and become larger. I would hate to see the market, consolidate around one or two players, even though I may be shooting myself in the foot, saying that. But I actually think that the market a couple of years from now is going to be a little bit different. I think it's going to look a little bit more like the highway system, where there's going to be just a couple of, major highway system by which digital healthcare flows. But at the end point, once you get off the highway system, there's going to be a lot of roads to different specialized products that can be engaged through that highway system. And solution flows, you find your way through Google, but then Google leads you to websites. The internet is not Google. Google is just the way to discover what's on the internet. And I think it's going to be relatively similar to that. The brands of healthcare are going to be endpoints. The providers of services are going to be essentially producers of goods, and the highway systems, and hopefully will become, one of those highway systems, are literally going to be the piping, the neutral Switzerland-like piping that allows all of these products and services to be exchanged.
Mhm.
And I think that in healthcare, even more than other worlds, that's probably likely because people really appreciate brands that they trust. I don't think those are going to go away. So I think this model of a highway system with a lot of, end products that are branching off it, but can be discovered and reached through that highway system, I think that's what we're going to see in a couple of years.
When I think about the evolution of EHR vendors, so initially there were, hundreds of these small vendors, a few players kind of gobbled up some of the groups, and then you had maybe 10, 20 out there. And eventually everybody had an EHR.
Yeah.
And you almost ran out of, there's certainly maintenance and updating and improving upon the product. Do you think something similar could happen in the telehealth market? Once everybody's kind of hooked up and connected, we're going to move into a different phase?
Well, I think it is, it's very important that the market continues to add components, to keep pushing the envelope. If you are in anything in technology, if you're in steady state, you're dead. You're not going to be there a couple of years from now. I think that in, a little bit like historically when we bought a phone, 10 years ago, sending an email over the phone was a novelty. And then text message show up, and then social networking showed up, and then video conferencing showed up. And it's the same phone, you have the same phone companies, but the spectrum of things that you can do through them is continuing to evolve and astound you. And Netflix showed up and all of that kind of stuff. And I think you're going to see the same thing, in telehealth. The piping is going to have to diversify and expand to allow a lot of different kinds of services. Today, in our lens today, which may be different 5 years from now, we think about remote patient monitoring and home care and automated care. These are the frontiers. They're going to gradually become blah, because everybody can do them, but there are going to be new ones that are going to come in. There's going to be sensors that are tied into, our clothes or anything else. I don't know what the future is going to bring, but these will continue to invent themselves. I think the care that can be productized digitally is going to expand dramatically. So I don't think that the market is going to get saturated. Just like, by the way, you have a small group of EHRs, but if you look at Epic, it has the App Orchard store, where now there is a booming world of applications that's on Epic, but it's not Epic. So, and the same goes with, great solutions by Cerner and others and so on. So I think this is what's going to happen. It's just going to change the way it's done. I don't think that it's going to get saturated.
Interesting. So do you see Amwell as more than kind of just a telehealth platform? Are you, going to get into remote patient monitoring, or do you see yourself as kind of the connector of all of those different pieces?
Yeah, I think, there's a humbling moment, in telehealth where you understand that you're not the story anymore. And I think we need to take a deep breath and understand that there's a bigger story here. And at least our view, in literally recent years with a new set of products and everything else, is that we need to tie in well with products that are great, that are made by other companies. And we need to be able to make it simple for people that could utilize those products to take them in and utilize them. In your word, it's a connector, view more than anything else, a platform view more than anything else. But I think that by embracing the innovation of others, not stopping our own, but embracing the innovation of others, we actually have a much longer, time horizon for the value we bring than if we try to do it on our own.
So I'd imagine those partnerships are really critical in terms of.
Yeah, they're very meaningful. There's no question, and they continue to grow.
Yeah. Well, one interesting fact people may not know is that Amwell was actually co-founded by you and your brother.
That's right.
And I actually read an article that mentioned that you two have been in a lot of different businesses together. So this is really a family business. And I read a story about one of your first businesses. I didn't hear the story, but it was something about a mule. Could you share that with us?
Yeah, sure. It's not okay. This is many, many years ago. We were very, very young. I think we were like 14 or something like that. But we worked together since then and grew up in a place where you could actually have a farm or something. And we actually had 2 donkeys. And we had an initiative on our own without our parents to do a trade. And we traded our 2 donkeys for a mule.
The family donkeys?
The family donkeys were traded for a mule. Only, and we came home and we thought this was a great business transaction, only to find out, in a couple of days later, when my parents were kind of start looking, well, what's the mule doing and everything else, that the mule was blind. So what seemed like a great business transaction was actually a very, very bad one. First thing, I guess, lesson learned is you gotta involve your parents at that age because they have a little bit more experience. But maybe if I'm trying to think about what that means in today's world, don't buy features, buy value. we thought bigger mule looks like a horse. Let's buy that. Big mistake, didn't work out, but that was definitely our first business transaction.
So what is that like with a family business like that? So you guys have been doing this for years. I mean, how is that?
Yeah, I mean, you learn about over the years. There's no question. I think one of the biggest advantages, there's a reason why there's a lot of family businesses. I think one of the reasons why it's so useful and good is because, first of all, there is an implied long-term partnership. You're not 2 people who are working together for a period of time and everybody's thinking, what's my next gig or whatever it is. You are married in many, many ways. And I think that allows you to actually not be concerned about being disintermediated. And that in turn allows you to focus on the things that you love doing and that you're good at. And allowing other people in the family or otherwise to really do, other things that need to be done and you're not very good at. It takes a long time to oil that machine, to really understand how to separate what Ido is very good at versus what I'm, decent at or whatever it is, and make it work together. But we had a lot of time to do so. So we got it to work after, I don't know, whatever, 35 years of doing this.
Wow. You've come a long way from the mule.
Yes, we learned a lesson. For sure.
Finally, we really like our guests to share some words of wisdom or pass on some career advice. If you could go back in time, what would you tell yourself to do differently? What would you tell a young Roy to do?
Other than don't trade donkeys.
Yes. Yes.
I think one of the things that I wish I would have done earlier is ask myself, do you really know what you're good at? Because, society tries to make you feel that you need to be good at everything, and there's no way to be that. And then you try to make yourself good at things that you think are going to make a lot of money or, are going to be perceived more prestigious or whatever it is, and so on. And often that doesn't work and it's frustrating and so on. I think that taking the time and the honesty to find out what you're really good at is a very worthwhile investment. And you need to be very honest, because sometimes it's not going to be easy to hear. And if you adapt your career or your path accordingly, I think that you're going to be better off, because you're going to likely you find more success. You're going to get better at this and separate yourself from everybody else, and actually have a chance of being wonderful at what you do. And that usually comes with a lot of happiness as well, which is a very, very important part of the life balance. So I think that's one thing that I would say. And maybe the second thing that I would say is actually something that I kind of keep reminding myself, and that's actually a quote from some other guy, Scott Galloway, that said that, nothing is ever as good or as bad as it initially seems. And the reason for that is because human nature is that when something bad happens, we tend to think that it's worse. We tend to take it further into the bad side. And when something good happens, we tend to inflate it and make it wonderful. And long term, neither one of these are true. So there is a lesson learned that when something happens, maybe the equivalent of take a New York minute, take a second, let it sink in, take a little bit of a distance and remeasure it, because your initial measuring of it is usually not right.
Well, you've certainly given me a lot to think about. I appreciate that. Thank you for sharing that.
It's a pleasure.
And thanks for joining us today, Roy. It's always a pleasure, and look forward to talking to you again. Thank you.
Jen, always a pleasure, onwards and upwards, and I look forward to crossing paths anywhere and everywhere and anytime.
All right. Thank you.
Terrific.